Video number 4. Are we actually on number 4 already? I think we are. I've been getting inundated with a lot of information about reopening. And so I want to share with you where we are on reopening our office. I threw together this video a little bit more quickly than some of the other ones, so it may seem a little bit more disorganized, but I wanted to get it recorded and uploaded so that I could get it to you as soon as possible. So let's just dive in and see what we've got. Reopening our offices. What are we going to do about reopening? When will we reopen? How will we reopen? Who's going to decide? What criteria are we going to use? All those questions are being addressed by Dr. Hartman. He has been reading all the information that's been coming out from the state and from the ADA and from the IDA, and we've made some decisions regarding reopening, at least tentatively. So let me give you a little bit of background. The federal government did give us some guidelines as far as reopening, and I'm going to read a couple of those to you. The federal government gave us guidelines that talk about how it would be safe to reopen if several things happen. And the guidelines talk about a downward trajectory of documented cases, a downward trajectory of influenza-like illnesses, a downward trajectory of positive testing, for all of those things for a period of 14 days, 2 weeks. So the federal government is recommending that we look for that data, that we look for that downward trajectory of cases and testing, positive testing, and symptoms to indicate that we are, in fact, starting to flatten the curve and that it would be safe to begin some business activities. So that's what the federal government has suggested. You may have been hearing about some states that are not experiencing that downward trajectory, but they are still planning to reopen. Georgia's a case in point. In the state of Georgia, they are opening restaurants. They are opening healthcare facilities. They're actually opening salons, hair salons, bowling alleys, a lot of social type activities as well, as early as yesterday and today. And we'll see how that plays out, because they haven't been experiencing a reduction in cases. As a matter of fact, they have some hotspots in the state, but they're going to proceed with opening anyway. Just a little bit of a sad story. I don't know how many of you know this, but I was born in Kentucky. I was raised in Kentucky, and my mother's people are from Kentucky. They're from the hills. And there's an expression in the hills of Kentucky and West Virginia and Virginia, and that expression is the canary in the coal mine. And that expression comes from a practice that miners used to employ a century ago, before we had the technology that we do now. But in the early days of coal mining, the coal mining teams would take a canary in a cage, a pet. They would take it down in the mines with them when they went down every day to mine the coal. And they would keep an eye on the canary all day long. And if for some reason they happened to look over and notice that the canary was dead as a doornail, laying on its back with its feet sticking up in the air, then they would know that they had entered an area of the mine where there was some toxic gas and they needed to get out right away. They took the canary with them because the canary is little. It's got a small body size, and so the toxic levels of chemicals would affect the canary much more quickly, and it would be like a sign. It would be a warning to the miners that they had entered dangerous territory and they needed to get out. I have heard some people use that phrase, the canary in the coal mine, to describe the state of Georgia. They're our canary in the coal mine, so to speak. They're going to go ahead and reopen and see what happens. They're going to be like our guinea pig. So with that being said, let's take a look at what the state of Indiana has said about reopening. The governor of Indiana extended his stay-at-home order through May 1st for the general population and for most businesses. Things like restaurants, hair salons, movie theaters, tattoo parlors, bowling alleys, all those kind of things are supposed to remain closed until May 1st. But there is some interesting information in the governor's most recent executive order that does talk about dental offices, and I'm going to share that with you. And I'm reading right from the governor's executive order. And it talks about healthcare providers. And when it talks about healthcare providers, it includes dental providers. And then it talks about healthcare facilities, and it specifically mentions dental facilities. And this is what it says. Any current restrictions involving procedures that have been imposed by an executive order will be reevaluated for possible modification as warranted by circumstances that would allow them to resume commencing as of midnight, Sunday, April 26th. In addition, these restrictions on procedures will be reevaluated every 7 days thereafter for any appropriate and timely modifications. So basically what the governor is saying in this executive order is that as of 12:01 a.m. on Monday the 27th, we are cleared to open. Then, in addition to this executive order, I've read the question and answer section on the state's website where it talks about it's going to be a practice by practice and office by office call, and the dentist involved is going to need to make that call based on whether they have the PPE in order that they need and what situations are like and trends are like in their geographic area. I checked the Indiana Dental Association website, and their response is basically the same thing. They recommend that dentists make this choice and make this call on a situation by situation basis based on the data in their area and whether or not they feel like they have the PPE to keep their patients and especially their staff safe. So we're looking at data, and science doesn't lie. Data doesn't lie, and it can't be manipulated based on a whim or based on what you wish it would say and what you want it to say. I mean, it is what it is. So I'm going to share with you some data that I have collected from the state, and we're going to take a look at that. I'm going to attempt to show you some of these graphs by turning my camera toward my computer. Hopefully you'll be able to see them okay, and that way you'll be able to see with your own eyes what the trends are that are happening in our state. So, first graph. God, I love graphs so much. All right, first graph. I'm going to show you a graph of the cases, positive testing cases that have been documented in the state of Indiana since we began tracking. So here we go. You can see at the beginning over here that there were 1, 2, 0, 1, 2, 3 cases a day. Then you can see that as we move through time, we start to diagnose, and this is day by day case diagnosis, positive testing results. So you can see that we hit some peaks, and then everything started to kind of slack off. Right here, this point right here, that is the highest single day diagnosis of COVID-19 in the state of Indiana to date. The date on that is April the 16th. So that was 1 week ago from today. Then there was a dip and another rise. Now I don't have data for yesterday, which is the 22nd, but as of the 21st, we were only experiencing a 4-day reduction in cases. So that's not nearly enough to justify reopening based on the federal guidelines. The federal guidelines call for a constant reduction in diagnosed cases for a 2-week period. Now, this data came from the Indiana Department of Health website. I have another graph that I want to show you as well. What I've done is I've pulled together some information from the counties that are relevant in our area. I'm going to try to get this whole graph in. You guys all right out there? Getting dizzy from all this? if you can see these numbers, the red numbers, the red data at the bottom here indicates Floyd County. So the Floyd County numbers indicate that we had a couple of peaks back here in early April, and that these are our most recent numbers. On the 20th of April, we had 2 new cases reported in Floyd County, and then on the 21st, we had 6 new cases reported in Floyd County. I don't have the data yet from the 22nd, but the fact that there was a significant rise just as recently as a couple of days ago kind of concerns me. The blue data that you see here is Clark and Floyd County combined. So you can see once again that we've been going up and down and up and down and up and down. On the 20th, if you look at both Floyd and Clark counties together, there were 6 newly diagnosed cases of COVID-19 reported in Clark and Floyd County. Then if you look at the 21st, in Clark and Floyd County together, there were 13 newly diagnosed cases. So what we're seeing in the past few days, or in that 2-day period, is an increase, not a decrease. Then lastly, you've got these orange numbers, and the orange data numbers are a total of a 5-county area that surrounds us. The orange numbers represent Floyd, Clark, Washington, Scott, and Harrison counties. Those 5 counties together had 14 new cases of COVID-19 reported on the 20th, and then on the 21st there were 30 new cases reported. So this data just indicates that it looks to me like we did reach a kind of a peak, a kind of a spike in very early April, but we've been experiencing an up, down, and not a significant decrease, a steady decrease, I guess is what I should say. So once again, in our area, we're not seeing that steady decrease that I would hope we would see. Let's talk about flattening the curve. We've heard the phrase, flatten the curve. And I want to try to explain to you what that means. The data that I've showed you so far is day by day by day data. But when you look at cumulative data, that means taking one number and adding it on to the day before, and then adding it on to the day before, and then adding it on to the day before. That's what cumulative means. And when you're talking about the curve, you're talking about cumulative data. What I'm going to show you next is a graph. I'm really sorry if you guys can hear that noise in the background. My husband is currently tearing apart our basement. But what I've got here is a graph of the number of diagnosed cases of COVID-19 in the state of Indiana on a cumulative basis. That means adding together all the cases as they accumulate. So here's that graph. Over here around the early part of March, there were few. Then they started to rise, and you can see this number is this is like a curve here. It's a curve that's starting to go up. It's showing that there were 7,000 cases, then 10,000 cases, then 12,000 cases. If the curve were flattening, we would see it go something like this. That's what they mean by flatten the curve. So if we saw the numbers start to level off, we would know that we were flattening the curve and that our isolation and stay home initiatives were working. This is a statewide graph, and I am not thoroughly convinced that our stay-at-home measures are working. And Dr. Hartman has taken a look at all of this data as well. We've looked at it together. We've talked about trends. We've talked about diagnoses here in our area, and we're just not really convinced that it's safe to go back to work yet. So this is our plan as of right now. As of right now, we are shooting for and looking at Monday, May the 3rd, 4th. Hang on a second. 4th. Right now we're looking at Monday, May 4th as a reopening date. We're going to keep an eye on the data. And if the data trends are really disturbing, we may rethink that. We are absolutely not opening on Monday, the 27th. Some offices are. We heard from Dr. Hermigausen, and he's opening on Monday, the 27th for any kind of procedure, not just emergencies. And he wanted to call and let us know that, so that in case we had any referrals, we would send them over. It's perfectly fine for me if Dr. Hermigausen wants to be the canary in the coal mine. We can let him practice for a week and see if his staff gets sick or if there's any potential problems with reopening. We can let them be the gauge for our profession if they want to. We'll go ahead and we'll keep an eye on other offices, other general practitioners, and see what they do. Let them go first, test the waters, and see how it goes. I'm perfectly content with waiting. I don't feel the need to be a trailblazer. I feel the need to be a safety advocate, and Dr. Hartman absolutely feels the same way. So much so that we're seeing patients this Friday, tomorrow. There's a few emergencies that we have scheduled. Then next week, the 27th through the 1st, we are seeing absolutely no patients. 0. Not even emergencies. For goodness sakes, if they've waited this long, we're not going to bring them in on Thursday or Wednesday when they can wait a few more days and they can come in the following Monday. Dr. Hartman made that call, and it's strictly because we want to make sure that he and anyone else who might be called in to work next week, we want to make sure they stay home, they stay isolated, and that we all stay safe, so that when we get ready to open on Monday the 4th, we will be ready to hit the ground running with our health intact, our PPE pulled together and ready to go. So that's what we're looking at. Monday, May 4th as a reopen date with patients. There's so many questions, though, that need to be answered. How are we going to screen our patients? Are we going to take their temperature? Are we going to make them switch with hydrogen peroxide or Paradex? Are we going to change our PPE that we're wearing? Are we going to change the way our administrative team dresses? Are they going to have to wear masks all the time? There's just so many questions that we need to address. So to that end, we're going to do a couple of things next week that absolutely do not involve patients. But we are going to have a couple of meetings next week. So you need to mark these on your calendar if they involve you. On Thursday the 30th, we're having an executive team meeting at 9 a.m. That will include Dr. Hartman and Michelle, Joni, Kristen, and me. We're going to get together and try to solve some of these problems, brainstorm some solutions, put together some protocols, and get you all some answers so that when you do come back to serve your patients, you'll know what's expected of you. Then on Friday, May 1st, also at 9 a.m., we're going to have an all-staff meeting. That will be for us to roll out our protocols and our new infection control policies, our new PPE requirements. We're going to make sure that we prioritize administrative duties because there's a lot of things that haven't been done for several weeks. So we need to talk about who's going to do what and what's going to take priority. We're going to talk about our philosophy moving forward as far as dental treatment. So there's a few things we're going to cover at that staff meeting. So that'll be on Monday the 1st at 9 a.m. Between now and then, we're going to very carefully monitor data. We're going to watch both countywide and statewide. We're going to watch the number of cases that are being diagnosed. We're going to take a hard look at some of these states that are allowing businesses to reopen. For example, Georgia. They've had some people reopening, like I said, restaurants and health clubs, gyms, beauty salons, those places have been reopened as of even yesterday or today. So the incubation period for COVID-19 can be anywhere from 2 to 14 days. That's why that 14-day period is kind of a buzzword. It's kind of a gold standard of how long you need to stay isolated. But the reality is that the average duration for patients to be incubating the virus before they start to show symptoms is 5 to 6 days. So I believe that if Georgia has made a mistake and they have exposed most of their population to this virus, and we're going to start to see a significant increase in diagnosis of cases down there in 5 to 6 days. And that will give us, as the lagging indicators, that'll give us the opportunity to evaluate their data and try to decide what it is, if anything, that we want to do with it. So, summary. We're tentatively looking at Monday, May 5th as an opening date. We are looking at Friday, May 1st as a staff meeting time, 9 a.m. And we are looking at Thursday the 30th as an executive team meeting date at 9 a.m. So far, so good. All right. There are a couple of things that a couple of bees I wanted to put in your bonnet before I sign off. First of all, I would like, if possible, for everyone that works for us to plan on having 1 or 2 of your own, or 3, of your own cloth face masks. What I want is for us to have access to a cloth face mask that we can wear during morning meeting, maybe during times when you're just talking to a patient, when you're just kind of gathering their data, asking about their pain levels, that kind of stuff. We would absolutely never do any dental treatment with a cloth face mask. But I feel like if we all have 1 or 2 cloth face masks we can wear when we're charting, when we're in the break room, that will relieve the demand on our actual face masks. So if you can come up with something like that, a couple of those for yourself, that's going to really help us. And that applies to administrative team too, because we're not really sure what we're going to do with the administrative team. But I feel like we all need to have a couple of face masks around that we can pop on in case we get in a situation where we are in close contact with other people. The second thing I want you to be thinking about and planning forward is regarding your uniforms and your personal protection garments. In the past, most of you have dressed at home, worn your uniforms, worn your scrubs into the office, and then at the end of the day you wear them home. I can't make you not do that, but I would highly recommend that you consider wearing your street clothes to the office and dressing in your scrubs once you get there, and then taking those scrubs off before you go home and putting your street clothes back on. And then we will wash our scrubs at work with gloved hands and face masks on. That's one of the reasons why we provide the washer and dryer, so that you can do that. And that's going to be a personal decision that each one of you will need to make. But my recommendation is that you may want to get in the habit of changing into your street clothes before you go home. And to that end, if you need to somehow mark your uniforms, or if you need to grab all your scrubs from your house and bring them with you, bring them back to the office when you come back, that's something to think ahead about. So that's my other thought for you to kind of be kicking that idea around between now and next Friday. So that's the information that I have to share with you. I would encourage you, if you're bored, to visit the ADA website and the IDA website. They do have some information about reopening, some recommendations about PPE and infection control. And if you have read some of that before next Friday's staff meeting, that might be helpful to you when we start talking about things that we're going to do and why. It's just strictly a recommendation, but something that you may want to consider. So that's what I have for today. I'm going to upload this video and get it to you as soon as I can. And have a great Thursday. Bye.